Well, the new technology has basically two versions. One of them is for hormonal balance primarily,
Okay.
and of course weight control and reduction of obesity. And the second part of it is more for vaginal rejuvenation, but at an older age. Um,
Okay.
Basically, the lecture that I gave had to do with research that we did. We looked at women that had laser and radio frequency procedures, and they reported very good results on the FSFI. However, when you compare that with the light scale of MMPI, which is a psychological instrument, the FFSI had a very high correlation with life scale. So what we looked a little deeper, and basically a lot of women want to satisfy their partners. They don't, when they say, do you have more orgasms, they're not thinking of their orgasms, they're thinking of the orgasms of their partners. So the doctors that do
Yes.
vaginal rejuvenation, they have to look deeper, and they have to basically understand, get a more comprehensive perspective of hormones, of appearance. A woman that is obese, of course, the sexual satisfaction is going to be reduced. So all of those components, along with the vaginal rejuvenation, are very important, and one depends on the other.
Yeah, that's absolutely important, Dr. Rasanya. Okay, I know that you have also co-authored with Dr. Shital with all the subjects from India, as you mentioned, and then had a significant decrease in the abdominal girth. Okay,
Yeah,
so
that was her
now maybe,
patients primarily. It was Dr. Shital's patients.
yes. Okay, and that's it. So now maybe Dr. Shita could also be parting in, or actually could be answering some of the questions here. Okay, so what would be the recommended exercise regimen for non-diabetic, pre-diabetic, as well as diabetic patients without having to go through the or going to suffer from the complications of having a strenuous exercise and overdoing it, and also prolonging the exercise, meaning of course say the complications of the what's that, the ghrelin and the leptin, and also the other complications of having prolonged exercise amongst diabetic and pre-diabetic.
Okay. It is little difficult to achieve this balance. Ideal way would be to balance aerobic exercise, some resistance training, and that kind of thing. But as I mentioned in my study, this technology that we used in this study does achieve
Yes.
these results without increasing the stress. In fact, it actually
Okay.
reduces there's no stress induced as you see with the exercise with this technology.
Okay,
So that is a
doctor.
good way to the diabetic and pre-diabetic patients, and even other obese patients can benefit from this.
Okay, so you recommend also that in combination with the exercise and plus, of
Yes,
course, the technology.
yes,
Oh,
yes,
that's
yes,
good. That's so
yes.
great. It's fantastic. Okay, and then of course, Dr. Shital, another question would be any adverse effect or side effect that
Uh,
you can have from this
no,
this
none.
technology.
No, there are no side effects, and I have not come across any side effects so far. I've been using this almost since 9 years now in my
Wow.
practice. And
Oh, that's great.
yeah, as I mentioned, there are a couple of just one or two contraindications. One is a
Yeah,
pacemaker,
pregnancy.
pregnancy, obviously, and implanted devices like pacemaker is a contraindication. But maybe bleeding disorders, if the patient is suffering, you would have to be a little careful. But apart
Okay.
from that, no side effects. I've not observed any adverse effects.
How about those diabetics who are actually having a surgingly high glucose, and then at the same time they're almost just at the borderline to having, okay, say dialysis? Can
Okay.
this be also used?
Yes, it can be used. Definitely, it can be used because it doesn't put any kind of a stress. It doesn't increase stress in the body like exercise does, the prolonged exercise does. So actually, it's safer for these patients,
Okay,
who
so
have very
absolute.
high level. Yeah.
Right, but absolutely not for any renal failure case, right, Doctor?
Yes, yes.
Doctora,
Renal
okay,
failure,
thank
you cannot. Yeah, yeah,
you cannot. Thank you so
yeah,
much
yeah.
for that. Okay, and then of course with Doctora Margarita Lemilyanova, so when do we start, okay, doing PRP for vaginal laxity?
Trial
Okay, so
version.
when do we start? Okay.
Trial version.
Okay, so I
Trial
think
version.
we're having some glitches or technical difficulties as Doctora Margarita couldn't hear me from
Trial
this.
version.
Can you hear me, Doctor? Yes, Doctora?
Trial version.
Oh, I'm sorry.
Cannot
Couldn't be
hear
heard.
you.
Trial version.
Doctora, okay. So we'll get back to you, Doctora. We'll get back to you in a while.
Trial version.
Get back to you in a while, Doctora. So I'm having some, hand signal right now. But
Trial
of course,
version.
let's just go to some of the questions at the chat box. Is Dr. Dimitrio
Trial version.
already present? No, he's not around. Okay, so that we go to the chat questions. Okay. Okay, from Dr. Gisela. Oh, this is no, it's not a question. So Dr. Iris Templora. Okay, to Dr. Sanya, for how long, how many sessions would it take to see improvement in visceral fat reduction using this machine?
Normally we did 10 to 12 treatments. It may take
10 to
more
12.
if you're diabetic or
Okay.
if you have some health problems, because it will take much longer to balance out your hormones and basically get this whole process working and reduce your sugar, insulin, and all these other areas. But so it really depends. I think you want to
Yeah.
compare it. How long would you have to go to the gym to achieve the results that you would need? Basically, 1 year would be like 12 treatments, 2 years would be like 24 treatments. So some people will need 15, 20 treatments. So it's not,
Okay.
it depends where you start, basically.
Yeah.
So, and
Yes,
some
Dr.
people
Rashida.
Yeah,
will work
it
much
depends
faster.
on where you start. So the more fat percentage, the more BMI you have, you would require more number of treatments. But in 10 to 12 treatments, we've seen significant improvement.
Okay,
Yeah.
that's 10 to 12, the ideal. And then if any comorbidities, you go beyond it. Okay,
Yes.
Thank you, Doctora. And then, okay, there was a question that was raised a while ago, but we were able to answer it already regarding the yo-yo effect. How is it important to reduce? How do you actually prevent the yo-yo effect, Doctora Shital?
Yeah. So as I've already typed in the chat box. So basically,
Yeah.
if you increase muscle mass along with reducing fat, then that is the way to go to prevent the bounce back or the yo-yo effect. Also, reducing visceral fat is important because these two factors, gaining muscle will improve your basal metabolic rate. And also when visceral fat is reduced, that helps to improve the metabolism and the overall, health parameters. So these factors will prevent the bounce back.
Okay, thank you, Doctora, for that very good answer to that question. Okay, so I think basically these are all the questions
Dr.
that were
J?
raised. Yes, Doctora?
Yeah. I would like to ask also the opinion of Professor Yuri about the yo-yo effect diet. So what can we do about it, especially for those?
Yes, I totally agree with the previous my colleague, but I want to say that we have to understand that diet is not the kind of treatment. Diet is the kind of the lifestyle. So that's why
Right.
don't consider it. Yes,
Exactly.
it's not punishment. Our diet is not punishment. Right.
I'm smiling.
Yes.
Yeah, I agree with you, Doctor.
We're all smiling. No diet for that
Yes.
matter.
Yes. If you want to be healthy, you have to keep good lifestyle. Let's name
Yeah.
it lifestyle, not diet, not treatment.
Okay.
Okay.
So that's why avoid any stresses, because if you have any stress, any cold stress, any mental stress, any sleep stress, and so on,
Yeah.
your weight will be gained. because of the fats first. So that's why when you are in the lower point of your weight, please continue to gain your muscles, and please don't eat a lot of fats, because if you stop your diet, you will start to have yo-yo effect.
Okay, thank you for that superb answer, Dr. Nalasco rather. Okay, and now for the last question for Dr. Margarita Lemilianova. Okay, so when do we start doing or treating vaginal laxity using PRP? What
Trial
would
version.
be the contraindications, as well as the
Trial
when do
version.
we get the significant result after doing the PRP?
Trial version.
She is muted. Okay, Doctora, I
Trial
think you're
version.
muted. All right.
Trial version.
Oh, she's on
Maybe
mute,
Dr. Margarita
Doctora.
can you reply by typing in chat box? You may reply by
Trial version.
writing, not orally.
Okay, if
We
that will
cannot
be too
hear you. We
taxing,
are not
Trial
hearing
version.
you.
if it will be too taxing for our dear Dr. Margarita to be
Trial
typing
version.
her answers, probably we can just have her to actually just answer it,
Trial
through
version.
her email or to our chat box. And since we don't have much time anymore left
Trial
for us
version.
to be discussing some other questions, you did a wonderful lecture, all of you, and I thank you
Trial
for that.
version.
You are also very pronounced, very considerable in all this, and that you have significantly contributed in the medical field, especially in the aesthetic and anti-aging. We'd love to have you once again in the next convention or symposiums, and we thank you so much. God bless and
You're
stay
welcome.
healthy all the time. Now we're
Thank you so
going
much.
for the last part for this session number 3, and we're going to be awarding these certificate of recognition. Okay, these certificates